Hello everyone. So we're about to start with the demonstration in just a couple of minutes. I'm just going to give it about 3-4 minutes to see if more people can log on as we're coming into the hour. For the people that are joining us for the first time, we're doing these segments talking about our prevention efforts here at Behavioral Health Solutions. My name is Rafael Cepeda. I'm a prevention specialist here. The program that I work with is under Positive Action. For Positive Action, what we're doing is we go into the public schools and we interact with the students that are having the most issues. So the counselors and the teachers identify the students that are having either issues with their academics, they're having issues with their behavioral problems, or they're having behavioral problems. And so for us, we work with the same group of students for the half of the semester. So each semester we do work with 2 different groups at 2 different schools simultaneously. And so right now, obviously with COVID-19 and with all the guidelines that are going on, school's about to finish, we're trying to find new ways to work with different people. And so today, with the demonstration that we're about to do, this is one of the activities that we do. Besides presentations and besides the curriculum, we do activities. And this is just to interact with the community, interact with the students, for them to have some fun while they are learning. So for the drunk goggles activity, a lot of students do enjoy it. We have done this for all the levels. We've gone through middle school, high school, maybe some 5th grade, 4th grade, just when they're barely learning to understand, what drugs really are. So now as we're getting started, one of the things that we do always cover with these activities and even with the presentations is risk and protective factors. So with risk and protective factors, the best way that we can explain it is that risk factors are things that put students or even So risk and protective factors are, risk factors are what put students directly in harm's way. And so with that, what we're talking about in this picture, as you can see here, is that alcoholism, or people using any kind of substance, but since we're talking about alcohol, it is intergenerational. So it is passed on, or it can be passed on, right? You have a grandfather who has a son who likes to drink, who has a grandson who likes to drink, who has a great-great-grandson who likes to drink. And so the risk in that is that we're normalizing the behavior. You're making it seem like it is okay, it is normal. Hey, my dad drinks, my uncle drinks, I'm going to have to drink when I grew up. And so it sends a message, right, to the younger children that it is okay to drink, right? It is part of the growing up process that once you do turn, in our culture, maybe 18, 21, that it is okay for you to drink. The protective factor for that, right, the thing to counter that would be to have some kind of information, right, some kind of education, sit down, talk with the students, talk with the children, let them know, what it is that alcohol really is, what are some of the things that can happen to you, not just with your body, but socially. What are some of the negative consequences, right? You get arrested, you get something on your record. And so it does prevent you, from leading a normal life. And so, again, with the risk factors, what we're trying to do is always find something to counter that and, right, make it something productive for them. One of the things that I do want to talk about when we're talking about education is the blood alcohol concentration. A lot of people, they understand that when you drink alcohol, you are going to get drunk. One of the things that they kind of tend to forget is that when you are drinking, that alcohol is getting filtered into your bloodstream. And so that alcohol is inside of your blood while you are, walking around. And so that, if you have too much alcohol within your bloodstream, that is what's called blood alcohol poisoning, right? So some of the symptoms, sometimes people tend to forget what they are just because we're so used to them, but they are still symptoms, which some of them include, getting drunk, right? You have too much alcohol, your body starts to shut down, your brain activity starts to decrease. Another one could be vomiting. That's your body's way of protecting itself. It's saying, hey, you have too much alcohol in your system. It's trying to get rid of it. So vomiting is definitely something that is a negative, right? Another thing could be, having a hangover. That means that your body did not get sleep properly, right? So one of the things, again, that we're talking about here with blood alcohol concentration is just that you need to regulate the way that people are drinking, right? Excessive drinking, when people are binge drinking and college parties, high school parties, right? Kids don't know their limits. They're just drinking, they're chugging, and they don't understand, how much alcohol it is that they are actually putting into their system. One of the ways that we like to talk about that is with these displays that we have here. So this is actually talking about the calorie intake, but what we're going to focus on right now is the alcohol by volume. What that means is that how much alcohol is directly in this drink here. So like an average beer or an alcoholic beverage like this would have about 5 to 6%, depending on the makers. So in this whole liquid here, the whole volume of this, 5% of this would be alcohol. Right here we do have, mixed drinks. These are fairly popular among younger people. And so on this, you do have 40% alcohol by volume. So on this, again, the volume of the liquid itself is very different. But on this, obviously, it does have the higher percentage of alcohol. So this will get people, drunk faster. The thing on this, again, going back to the protective factor on education, is that a lot of students don't understand this, right? Like you have high school kids that are just, oh, this is only a little bit. I'm going to drink, 3 or 4 of these. I'm good. This will get you drunk much slower. But again, they don't understand. A lot of high school, even, younger people that are drinking, they don't understand, the differences in the alcohol by volume, right? The percentage that each drink has. And so you have kids that are ending up with blood alcohol poisoning because they're drinking vodka, they're chugging, tequila shots, and they don't understand that, yes, it seems like it's a little, but it's much more potent, much stronger, right? On this, going back again to the education part of it, we do have these home breathalyzer tests that we distribute. These we tend to focus when we work with college-age students or even adults, when we're working with UTRGV, when we're doing education tables, information tables at the campuses, STC. What we're doing is we're distributing these and talking to the students, about the safety, right? We're telling them not to be drinking and driving. Even if you had 1 or 2 drinks, that's still buzz driving. What we've seen here is that it tends to be about 2 or 3 alcoholic beverages before it shows up on the test. So even if you don't feel drunk, right, you've only had 1 or 2 drinks and you think you're okay, that's still enough to register in most breathalyzers. On this one here, what it is, it's again more like it's for home use. What it really is just a little cylinder. What happens here is you crack this, and in here there's a little bit of powder in here. That powder, once you blow into it the way you would into a regular breathalyzer, what happens is this powder here will change color, right? So if you've had 3 or 4 drinks, 2, maybe even 2, depending on your body weight, right? We're always, again, with education, talking about somebody that weighs more will have to intake more alcohol before they get, to those levels of they're drunk or it shows up in their blood system. But again, somebody that's smaller, it's going to take less alcohol for them to get drunk. So once that person blows into this, right, and they've had 2 or 3 drinks, this powder in here will actually turn blue. And that's actually letting them know that they will test positive on a breathalyzer in case they're pulled over. So we do this so that college students and even adults, again, think twice before they get on the road, right? Before they take that chance of, hey, you know what? I only drank 2 drinks. I should be okay. I'm okay to drive. I can still think properly. I'm going to get on the road. So if they have this on them, they can blow into it, and it'll, again, be definite proof that they will not pass the breathalyzer, so they should not even get on the road. Again, right now with the demonstration that we're about to do, we're going to show the effects that alcohol has on the motor skills, right? On your movement, on your balance. A lot of things that I tell my students when I'm working with them specifically is I tell them that you need to understand how each drugs are classified. So alcohol is classified as a depressant, which means that it slows down and it actually disrupts your motor skills, And so you're actually not thinking properly, and you're actually not able to have your balance or even coordinate properly. And so both of those things combined are obviously not good. One of the things, again, when we're talking about underage drinking, I always tend to bring this up, and this right here was a car wreck that happened just directly from where we're located at here in FAR. This car wreck was the result of an underage driver a person who was under the age that was drinking and was driving, a 20-year-old. So he needed one more year before he could purchase beer legally, and he ended up crashing, and he did kill a police dispatcher. So you do see, the effects on the vehicle. Obviously, I mean, that is a car there under all that, metal wreckage. And so when we're talking about this, is we're telling students, right? You're not just putting yourself at risk; you're putting other people at risk, right? You're changing, the dynamics of this family, right? They're never going to be the same, right? They lost their loved one. And again, we also forget the life of the driver who survived. His life is going to be changed forever. His family's life is going to be changed forever. And so again, when we're talking to the students, right, high school, college level, and even adults, one of the things that we always bring up is that, not just the person that is drinking is going to be affected by this, right? It's going to be the whole community, right? And again, that's the whole point of these segments that we're doing, is that we're trying to talk, how can we help our community, right? What are the things that we're doing to lower, substance abuse, in this case, alcohol use, and how can we help them, find the right resources. So right now we're about to get started with the actual demonstration for the drunk goggles. For this, it is a simple, I'm going to do two tests. The first one is going to be a simplified version of a sobriety test that a lot of law enforcement do right when they pull over somebody that they think is drinking and driving. For this test, again, it's very simplified. It's going to test the balance, which is going to be severely impacted by the drunk goggles. Now, what I always tell students is no matter what happens with these goggles, that is only affecting their vision, right? It's only they have the goggles on, it's going to be affecting their vision. Now, when they're actually walking the line, that's only affecting vision. It's not affecting their actual decision making, right? And so when somebody is drunk, not only is their vision impaired, it's also their decision making skills, right? And so this, although it's going to show you a little bit of the effects alcohol has, it actually is much worse once a person really is drunk. All right? And so I'm going to move the camera a little bit. So right here, I already have the line set up, right? And so on this line here, what's going to happen is I'm going to have one of my coworkers, and also, sorry guys, we have to wear these protective masks, right? The social distancing, we're keeping up with it. We're also trying to obviously not leave any kind of germs anywhere. So right now what's going to happen is, you want to introduce yourself before?
Yes. Hi, my name is Eduardo Salinas. I am the Public Relations Coordinator for the Prevention Resource Center here at VHS. Our program is basically in charge of analyzing, disseminating, and obtaining data throughout our region, which exists of 19 counties. We go out there and give presentations on this data. We try to work with local entities such as police departments, also schools, to try to collect and give them some data as to alcohol abuse, drug misuse, anything like that as well.
So again, if you're a first-time viewer, first-time hearing about our agency, besides the prevention programs, right, where we're actually trying to help with students directly, we also have programs that are analyzing the data. They're talking to law enforcement. They're talking to different segments of the community. And again, so it's like a big effort, right, to try to lower substance abuse and even help with mental health issues, right? So right now what you're going to do, Eddie, is you're going to have to, on this straight line here, you're going to have to walk with one foot in front of the other. So the way this works, what I tell the students is you're going to have to put one foot directly in front of the other, right? Heels to toe. Right now in a bit, I will get the camera and I will go in a little bit closer so you guys can have a better look. And so what's going to happen here is obviously the goggles are going to have an effect on him. So let's get started. You can go ahead and grab the goggles.
What's the goggles first?
So here we go. So right away he's going to just, he's just been pulled over. He does have his goggles on. He's already, let's just say he's drunk. So so you want to go ahead and put your hands right next to your body. There you go. So with your left foot, can you put it on the line, please? Okay, so for the people watching, he's having difficulty finding the line. There you go. The line is there. All right, so remember, you're going to have to put one foot in front of the other. So can you please start walking the line one foot in front of the other? Do you feel like you're on the line right now?
I don't.
You don't?
I can't really see it.
You can't really see the line. Okay, so you're stumbling a bit. So we're seeing issues with the balance. His arms, I did let him know to put him by his waist. He is flailing them around. That lets a lot of officers know that the person is drunk. So, okay,
I feel like I did really bad.
so you did really, really horrible, yes. So you want to go ahead and try to walk it one more time and try your best to really walk the line. Again, what I tell students at this point is that it's not a race. Right? When we're out in high school, we're telling students it's not a race. You're just going to try to walk the line. So here, he is doing a little bit better. He's still off the line a little bit. I don't know if you guys can see. He's a little bit off to the side still, even though he's trying his absolute best. So at this point here, what we tell students is that, again, what happens after the sobriety test usually is that you get put in the back of a cop car, right? You're going to be failing it if you're drunk, and you're going to end up posting bail. You're going to end up going, to county. It's going to end up, affecting you. A lot of times what people don't understand is that when you do get arrested, right, you have to post bail to get out. I tell the students then you're going to have to find a good lawyer if you want to fight the charges. Then the judge is obviously going to give you whatever sentence he gives you. And then that's going to be, money also spent. Then if you get probation or you get, any kind of programs like that, you're wasting money, right? It's not just, the one-time fee of you got arrested and now you got to get out. So here at this point, a lot of students complain. They say, sir, the line is too hard to walk even without the goggles. But can you try to do the line without the goggles actually? So here a lot of students complain. They say, sir, some people might not have good balance. It might be hard for them. So then, as you can see, it's not really that difficult if you're not wearing the goggles. So he's right on the line. He actually sees the line. So another activity that I always have lined up just to, go against people that say that the line is too difficult is this right here. So this is actually, we call it the Minefield, right? So all these little critters here, we tell the students, pretend that they're little mines. You don't want to step on them. To make it more challenging, we also say that you got to stay within the rope, and the rope itself you cannot touch. So, Eddie, do you want to try to walk, this time, let's do without the goggles first. You want to try to walk the line without touching the critters and without touching the rope itself. And again, it's not a race. You can take your time as long as you don't step on anything. So right here he's doing very good. Yes. So it's not too terribly hard. There you go. So he got across without touching anything. All right. So now can you go ahead and grab the goggles? And yes. So now he's going to attempt to cross the same. Here we go. So he's going to try to cross the same obstacle now with the goggles on. So he's a little bit to the side. He's already stepping off. There you go. He's touching the rope. Okay, okay. Okay, so he's stepping on all these items now. Okay. So Eddie, you're trying to not step on these items. It seems like you're trying to out of line. Okay, so you're okay. All right. So at this point, again, what we're talking with the students about is that their motor skills, their balance is going to be thrown off. It's not too difficult to walk this, and Actually, we do have another set of goggles. So actually, can you show the goggles to the camera real quick? So these goggles here, there are different types of goggles. These right here obviously are for alcohol, and also there's even different types of inebriation levels, right? So these right here, this is about, from what I read in the little display boxes, that this is about 10 to 12 drinks. So this is you're already pretty drunk. We do have another set of goggles. Again, when we're out with the community, we do try to take as many sets as we can, just to have a variety for the students. So these right here, these are almost basically blackout drunk. So these are supposed to be like you're about to pass out at any time. So Eddie, you're gonna put these on. You're gonna put these on.
Which am I gonna do?
Yeah, you're gonna do the line one more time. So this is the same set of the same test, but it is gonna be with different goggles. So Eddie obviously is blackout drunk almost. So here we go. So he has yet to touch the line. There we go. He finally got on the line. So again, this is only affecting his vision. It's not affecting his decision-making skills. It's not affecting anything else within his brain. So obviously, alcohol is has a little bit more of an effect. So now, again, we're gonna attempt to do the Minefield. Let me put some of these back in here. So again, with these goggles, a lot of students. Oh, actually, let me stop and say this too, because this is something real important that we always try to highlight with the students. A lot of students during this activity, they're having fun, right? They're laughing. They're, high-fiving each other. They're, sir, can I go again, sir? It feels good. I want to try it again. One of the things that I focus on is I tell them, okay, guys, now let's stop, right? And let's debrief, right? When we debrief, what we're telling them is, look, guys, we want you guys to have fun, right? The point of this activity is for you guys to be entertained, to have fun, but do not forget the message, right? We tell them, do not forget the message. So at this point, right, a couple of students have gone, 5 or 6 have gone. I still got 14 more to go. On that note, too, just real quick, I do want to let people viewing that we do clean the goggles, right? We have these sanitizing cloths. After every student, we try to clean them, right? So we don't spread any kind of germs or any kind of illnesses. So by now, again, 5 or 6 students have gone. And I'm debriefing with the students, and I tell them, okay, so now what we're doing is we're actually gonna, put something on the line here, right? So Eddie, right, just got pulled over. Let's just say for some reason a cop is gonna give you this test. I mean, obviously they're not, but I just do it to have fun with the students, and I say, okay, so if you fail this test, right? Let's just say I'm a law enforcement officer. If you fail this test, right, I'm taking you in right now. And then I even add a story sometimes to say, Eddie, right, I just pulled you over. You're coming back from a party. You're from out of town. You're out of town right now, right? You're not in the place that you know. Nobody that you know lives near you. You have your baby in the car, right? Your baby's in the car. So if you fail this test right now, I'm gonna have to take you in. And I mean, what's going to happen to your baby in the car, right? It's going to be placed in some kind of protective service. Family members are going to get involved, and so let's put that on the line, right? So you're going to put these goggles on, and so remember, your baby is in the car, right? And we do this again to make it fun for the students, but also to let them know that there's real life consequences, right? You're going to go to jail. Your family is going to get affected. So let's go ahead and you can start, Eddie. Okay, so right off the bat, he's already out of the circle, out of the rectangle. He's going out of his way, it seems, to step on every single critter now. All right, good job. Thank you so much, Eddie. So, all right, so coming back and debriefing here. So coming back and debriefing, guys. Again, with these activities, we're going back to the protective factor of education. A lot of students might not understand what it is to feel like to be drunk. They might not understand. I've heard students say, sir, people who drink and drive, they're dumb, they're bad people, they're mean people. And so for, at least on my end, what I try to get them to understand is that they're not necessarily bad people, they're just people who are making bad choices, right? And so, again, with this education, we're trying to put them in the shoes of the person, right, that is drinking and driving. We're trying to get them to understand how it is that they're feeling, what it is they're seeing. And we're trying to get them, from an early age, right? We try to do this in the middle school level, try to get them to understand that this is going to impair your vision, this is going to impair your decision-making skills, and you are going to make bad mistakes, and bad things can happen because of those mistakes. So, again, with the debriefing, we're just trying to get everybody to be on the same page, right, when it comes to drinking and driving, right? As a community, we all have to put our part in, right? With parents, we do a lot of presentations, we do a lot of activities with parents. One of the things that I like to focus on is that as a culture, right, as a community within our culture, is that we've accepted alcohol to be a part of our lives. You're watching a football game, right? And here, Miller Lite, the official sponsor of the Dallas Cowboys. Now, one of the things that I like to focus on with parents as well is that we're not totally against people drinking. We're not trying to campaign for alcohol to be illegal or anything like that. But what we're trying to tell people is you have to be responsible. You have to follow the rules, right? You have to follow the laws. They're there for a reason, right? And so when you're watching a football game, and, right, the official sponsor of the NFL, right, Bud Light, all this right here for kids at a young age, they start to accept it as normal, right? You go to a barbecue, right, there's a soccer game, everybody's drinking beer. You go to a quinceañera, right, you go to a 15-year-old birthday party, right, and every table, right, has a bottle, right, for a 15-year-old birthday party. Even I've gone to 4-year-old's birthday party, 3-year-old's birthday parties, and there's alcohol everywhere, right? The beer chest with all the alcohol in it. Growing up, I would always hear, "Mijo, tráeme una cerveza," right, from uncles or family members. And so we're putting it into our culture. We're making it as a rite of passage. It's normal for you to drink, right? When you turn, 18, 21, it's expected of you to drink maybe. And so we're just trying to talk to parents about that, right? Be more responsible with the things that you let your child see you do. I remember, when you're growing up, you see a parent that's using, alcohol or any other substance, and you think, why can't I do it? And the parent, what's the first response the parents say? It's bad for you. But then as a child, you're thinking, wait, if it's bad for you, why are you doing it? And then the parent will say, oh, it's because I'm older than you. But that doesn't really justify it, right? The kid's not going to understand, and it's not going to make sense to them, right? You're the person that I look up to. You're my role model, yet you're drinking this drink that you're telling me not to drink. And again, they're going to want to follow in the footsteps, especially if it's a role model. And so it's very powerful, even for parents to not drink around their children, not drink around younger children. That's a very powerful thing, right? It's going to not normalize, not make it okay for younger people to grow up thinking that I'm going to drink, right? So in the future, we will be doing more activities like this. We will be showing you guys more of the ways that we interact with the students, with the parents, with the teachers, with the staff. We've done trainings where we train teachers, counselors to see what they're going to do with their school, with their students. And so if you guys have any suggestions, right, as viewers, if you guys have kids in any specific school, if you guys have kids that are going to be in any specific summer program, feel free to comment, right, or reach out to us, and we can for sure, coordinate something where we can get together, work, within the guidelines, right, the new guidelines that we're going to be seeing with the programs, and see if we can work on anything, on any topic that you guys, need help with. And so, thank you guys so much for tuning in. Again, we will be having these segments regularly, so you will see me and some of my co-workers in the future. So thank you guys so much. Have a good day.